Let's now move on to stiffness, one of the most frustrating parts of recovery. It limits your ability to walk, bend, and complete daily tasks. But here's the good news. Motion is lotion for your knee. The first 3 months after surgery are a critical window for regaining range of motion. After that, gains in flexibility become much harder. But why is that? Well, this is because those initial 12 weeks, your body's actively remodeling tissues, pumping out swelling, and your joint capsule and muscles remain flexible enough to respond well to therapy. After this, tissues begin to mature and stiffen, making improvements tougher. So how do you stay ahead of stiffness? Well, stay active within your limits, frequently and gently. Avoid long periods of inactivity, which allows swelling and scar tissue to build up, stiffening the joint. Even short walks around your house or marching in place for a minute or two throughout the day can keep your joint mobile. This frequent movement pumps synovial fluid into the joint, nourishing cartilage and preventing adhesions. Another key is to commit to your prescribed flexibility exercises. These aren't just homework, they're an essential tool to maintain and increase your knee's flexibility. Skipping even a few days can allow tightness to set in and undo your progress. Aim to do these exercises at least 3 to 4 times daily, with multiple repetitions. Excessive pain discourages you from moving your knee, increasing stiffness risk. If pain limits your motion during exercise or daily activities, talk to your healthcare provider about optimizing your pain management strategy, whether adjusting medications or timing around exercises. And once swelling is controlled, gentle heat may help relax tight muscles before movement. Consider low-impact alternatives like stationary cycling or water therapy to keep moving without stressing the joint. Now remember, mild discomfort during your exercises is completely normal. It means your tissues are adapting. But sharp pain or sudden swelling is a warning sign to ease up because you might be overdoing it. By prioritizing frequent, gentle motion and managing pain well during the critical early phases of rehab, you give your knee the best chance to regain smooth, functional movement and avoid long-term stiffness that can really set you back.